Hi, this is Dr. Linda Burke-Galloway, author of The Smart Mother's Guide to a Better Pregnancy, blogger and OB/GYN physician. I'm sure some of you are aware that I have a cousin who is approximately 31 years old who's having her first baby. I returned from the baby shower, that was a couple of weeks ago, and it was wonderful and such a joy to see someone who I remembered being a baby now having a baby herself. So I offered her and other pregnant women some advice in a blog that I wrote on May 21st, and it's called, Can You Recognize a Labor Room Dilemma? Now, we think that having a baby is natural, and for the most part it is, but it is not error-free, and sometimes things happen in a labor room that we wish didn't happen. And so because I have, I guess you would call, behind the scenes knowledge of things that can go on and sometimes wrong, I wrote a blog to give her some pearls of wisdom. So see, these are some of the things that I shared with her. When she goes into labor, I'm going to call to ask, how is she progressing? Is she dilating at least 1.2 to 1.5 centimeters every 2 hours? I mean, the basic thing is she making progress, or is she stuck at a particular centimeter? Because if she's stuck, if I call, let's say at 3 o'clock and she's 4 centimeters, and then I call again at 7 o'clock at night and she's still 4 centimeters, well, obviously there's something wrong. The other thing that I wrote in the blog was, if she is in pain, I strongly encourage her to either receive pain medication or an epidural, because women who are pain-free have easier labors. There's no sense in being stoic if you don't have to be, and especially if you are distressed when you're having pain, because if you're distressed, your baby's going to be distressed as well. And the other thing I talked briefly about was the fetal tracing. The fetal tracing is extremely important because it's like an EKG of the baby's heart. And if you see something that looks like a roller coaster ride on the fetal tracing, it looks like U's, then something is definitely wrong, and her physician or midwife needs to intervene as soon as possible. Okay, so I write the blog, and I get this comment from one of the readers, and it was quite interesting, and I just want to share it with you. This reader says, I hope your cousin shuts off her phone during labor and doesn't call anyone until she is in her postpartum room. I hope she keeps her medical information away from, quote, helpful, unquote, family members. I hope she realizes labor is not a spectator sport, and no one is entitled to any information, pictures, or a, quote, spot in the labor room. I hope you realize how rude and intrusive you are being, and leave your cousin to labor and deliver in peace. Wow, when I read that, I kind of read it again and shook my head. And here's what I wrote to this viewer. I hope you realize that women and babies die unnecessarily because hospitals and labor rooms are sometimes on automatic pilot. I hope you realize that every month I review medical malpractice cases on behalf of the federal government about women and babies who were harmed unnecessarily because of incompetence and negligence. No, labor is not a spectator sport, but there are people who compromise their privacy on behalf of ego and money. I hope you realize that some women never make it to the labor room, never make it to the postpartum room, but end up in a morgue. I hope you realize that if you're an African American woman, your chances of having a complication is approximately 5 times worse than the rest of our population. Obviously, I continue to write, you've never experienced a labor room catastrophe, and your experience is limited. I happen to be a board-certified OB/GYN physician with 25 years of clinical experience, and know that sometimes people won't do the right thing unless someone is looking over their shoulders. So another reader wrote something in response to both of our comments, and I think this is also very interesting, and her name was Mary Ellen. I think it's great that you can be an advocate for your cousin, Mary Ellen writes. I wish I had someone like you there when I was having my daughter. I ended up with preeclampsia and the HELP syndrome because my doctor really didn't take anything seriously. I never thought I could get a hypertensive disorder because my blood sugar had always been low. Things can go from bad to worse in an instant. Sometimes people are too sick or too tired to fight for proper care. Having someone there or nearby to fight for them can make the difference between life and death. I am lucky I had my friend and RN there to push for proper care. Your cousin is very lucky to have you. I hope she has a quick and easy delivery. Thank you, Mary Ellen. Thank you so much for those comments. So, if you are in labor, I would thoroughly encourage you to have someone there who can at least speak on your behalf in the event that you can't speak for yourself. A doula or a childbirth educator is someone that would be very, very helpful in this situation. Those are my thoughts for today. This is Dr. Linda Burke-Galloway, author of The Smart Mother's Guide, saying, as always, remember that a healthy pregnancy doesn't just happen, it really takes a smart mom who knows what to do.